Hey y'all, this is Jess. Today I am going to be talking about different psychological personality disorders. There are 10 recognized by the DSM-5 and they are categorized into 3 different clusters based on overall behavior and how other people would label that particular behavior. So let's get into it. So just as a preface, this video is meant for educational purposes only. If you feel like you identify with one of these personality disorders or any of these categories, I would go to a professional and they would be able to help out with any diagnosis on that end. This is just to kind of cover what I learned when I was studying for the MCAT, and then if this applies to a college course as well, maybe like a psychology course, that's the purpose of this video, not to use it as a diagnostic tool in any way. Another side note, the nature of diagnosing with the DSM-5 is that each disorder is a collection of criteria, and if you meet like 4 out of the 7 criteria, then you are considered to have this particular disorder, etc. So there are some overlap because it is psychology, and that's something that's very variable depending on the person and depending on the symptoms. So you might see a little bit of that in there, and so that's normal, and I'm going to try to keep everything separated well so that way you don't have a hard time or confusing time memorizing them. So personality disorders, they are long-term patterns of behavior. They usually touch within the 4 different categories of interpersonal relationships, impulse control, emotion, and cognition. So they're essentially inflexible behavior that's maladaptive and that, can cause issues and impair functioning within those 4 categories, as well as like functioning in everyday activities. There are 10 different personality disorders, like I said, categorized by the DSM-5, and they are split into the 3 clusters, cluster A, B, and C. Cluster A includes paranoid personality disorder, schizotypal personality disorder, and schizoid personality disorder. Schizotypal and schizoid, they're both personality disorders. Schizophrenia is not a personality disorder, and it is a separate diagnosis. So there are 2 kind of terms that are used whenever discussing different disorders. One of them is ego-syntonic, which means that the behavior aligns with that person's mentality and what they want. So it's not seen by that person as an impairment. They just say, oh, well, I just like to, I'm just really a stickler for my plans and everything like that. That would be considered ego-syntonic behavior, and that's what personality disorders are. They're ego-syntonic disorders. Ego-dystonic disorders is when someone recognizes that the behavior impairs their functioning and it's something that they don't want. They actively see it as a problem. That's stuff like major depressive disorder. Schizophrenia falls under the category of ego-dystonic. So all these personality disorders are ego-syntonic. So the schizoid and the schizotypal are not schizophrenia. Moral of the story. And all of these in cluster A are considered, it's behavior that's exhibited with these personality disorders other people would consider to be odd or eccentric. So paranoid personality disorder, this is when there is a significant distrust or suspicion regarding others. And sometimes this can be just the prodromal phase of schizophrenia. Schizophrenia develops usually later in life, and it's caused by triggered trauma, and there's a genetic component, all of that, but sometimes the prodromal phase preceding schizophrenia can look like paranoid personality disorder. So really, if it goes on for a longer period of time and maintains with this paranoid personality disorder symptoms, then it is most likely that and not the prodromal phase of schizophrenia. The second one is the schizotypal personality disorder. This refers to a pattern of odd or eccentric thinking. They can have ideas of reference, which is just a milder version of delusions of reference. Delusions of reference is a schizophrenic symptom, and that is whenever there is like a TV going or two people are having a conversation in the other room and the patient thinks that that conversation is about them or the TV is addressing them. So a milder version of that is the ideas of reference that might be seen in schizotypal personality disorder. They can also experience magical thinking, which is just kind of like an extreme superstitiousness that comes with everyday life. Something that is a little bit beyond, the general superstitiousness that a person may feel without this personality disorder. Lastly, we have schizoid personality disorder, and this is defined as a pattern of detachment from social relationships. They usually don't have a lot of close friends, and they're usually pretty just kind of detached in general socially. They can also have a restricted range of emotional expression. Okay, on to cluster B. Cluster B, like I said, these are defined by the behavior that other people would label. So people who have the personality disorders in cluster B, other people might label this behavior as dramatic, emotional, or erratic. So this includes antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and narcissistic personality disorder. Firstly, the antisocial personality disorder. So this is often used incorrectly in conversation just to refer to someone who's very introverted. However, antisocial personality disorder includes patients who don't really have a lot of capacity for other people's feelings. There's not empathy there. There's no regret for actions, especially if they've hurt people. There's no regret there. They often have repeated illegal acts and can sometimes express aggressiveness. Next, we have the borderline personality disorder. It's a pervasive instability in interpersonal behavior. Their mood, their self-image can be affected. There is an uncertainty in their self-image, in their identity, and in their long-term goals. There is often a fear of abandonment, and then a defense mechanism for a person with this personality disorder might be splitting, where they see one person and then they define them as wholly good or bad, kind of as a defense mechanism, like I was saying, for their behavior, where this person is against me, they must just be a bad person. And so that's kind of a common trait of borderline personality disorder. Next, we have histrionic personality disorder, and this is constant attention-seeking behavior. So this can be wearing loud outfits. It can be, using seduction as it's defined, seductive behavior. And this is all in an effort to gain attention and a lot of extrovertedness. Again, this is not to say like people who are introverted are antisocial and people who are extroverted have histrionic personality disorder. These are legitimate disorders. And this is just kind of some of the traits that go along with them. Lastly, we have narcissistic personality disorder. This is definitely very familiar to a few people just in conversation. It tends to be a little bit more well known. It is a grandiose self-image, like fantasies of success, and all of that is just due to their presence a lot of times, or what they've done has, created all of this success and not really attributing it to other things. The contrasting symptoms to the grandiose self-image that comes with narcissistic personality disorder is the very, very low self-esteem and kind of the defensiveness or aggressiveness that comes with any guilt or shame that they might feel towards the person that is making them feel this guilt or shame. So it's kind of a juxtaposition between, they are the best, I am the greatest, everything like that, and also if I do feel guilt or if I do feel shame, very kind of an aggressive response. Lastly, we have cluster C. Cluster C includes any personality disorders that exhibit behavior other people would call anxious or fearful. And so this is avoidant personality disorder, dependent personality disorder, and obsessive compulsive personality disorder. That last one, it's OCPD, which is ego-syntonic. And then we have, because it's personality disorder, which is different from OCD, which is ego-dystonic and is not a personality disorder. So first, avoidant personality disorder is marked by extreme shyness or fear of rejection. They will often see themselves as socially inept and kind of exclude themselves because of this fear of rejection. Essentially, what the name says, they're very avoidant of social interactions. Dependent personality disorder is characterized by a constant need for reassurance, and patients tend to be, as the name implies, dependent on a person in their life to make a lot of the decisions and outline a lot of the goals that they have in their life. And last but not least, the obsessive compulsive personality disorder, making it OCPD, is someone who is inflexible. There's no changes in plans, excessive stubbornness, stuff like that. So OCPD in conversation would fit the image that a lot of people are picturing whenever they say that someone is OCD, like they're very particular with certain things. That fits more of OCPD with that inflexibility and perfectionist kind of mentality that comes with OCPD, which again is ego-syntonic. OCD, the ego-dystonic disorder, is obsessive compulsive disorder, and that's just, it's not one of these personality disorders, but to explain it. But there's these obsessions and then the compulsions that relieve the tension that is involved with the obsession. And so that is why it's called obsessive compulsive disorder. So those are all the disorders. Like I've been mentioning, the DSM-5 outlines these 10 personality disorders in the 3 different categories. DSM-5 is used for diagnostics in different psychological disorders. And so that's why I keep referencing it, and that's why it's kind of the Bible of psychological disorders in the way of identifying and diagnosing. So within these 10 personality disorders, there's the 3 categories that they are put into. Cluster A is behavior that can be labeled as odd or eccentric, and this includes the paranoid personality disorder, schizotypal personality disorder, and schizoid personality disorder. Cluster B is behavior that others would label dramatic, erratic, or emotional. And these include antisocial, borderline, histrionic, and narcissistic personality disorder. And then the last cluster, cluster C, this is behavior that others would label as anxious or fearful. It's avoidant personality disorder, dependent personality disorder, and obsessive compulsive personality disorder, the OCPD. So that's it. That's the video. If y'all liked it, please give me a like. If you want to see any more content, anything specific that you want me to make a video about, I'm always open to new ideas. I have a few more videos already lined up, but I can put it in front because if that's what you guys want to learn, that's what you want to learn. All right, thanks. Bye.